Hello everyone, we are Group 2. We are tasked to report to you the philosophies of Jane Watson and the grand theorist of Madeleine Leininger.
I'm going to discuss to you a brief information about Jane Watson. Now, Jane Watson was born in West Virginia, U.S. and graduated with a Bachelor of Science in Nursing at University of Colorado in 1964. And in 1968, she earned a Master of Science degree at University of Colorado. In 1973, she again earned a Doctor of Philosophy at University of Colorado, and she was distinguished as Professor of Nursing and an endowed chair in Caring Science at University Colorado Health Science Center. And she is also a Fellow of American Academy of Nursing. Previously, naging din siya ng nursing at University Health Science Center and naging president din siya ng National League for Nursing. Naka-earn din siya ng 6 na honorary doctoral degree. In 1988, nag-publish yung theory niya sa Nursing Human Science and Human Care. The theory of Jane Watson, which is the theory of transpersonal caring, is also called theory of human. And noong 1979, na-develop ang model niya, which is the caring model.
And I'm going to present to you the theory of human caring or caring model. So first of all, what is the main point of this theory? Jane Watson's theory of caring focuses on transpersonal relationships that are formed between patients and caregivers that go beyond the surface. The connections allow the nurse to give care that heals the entire body, whether it be physically, mentally, and spiritually. And what is caring? Caring is an act of showing compassion and concern for others. This also means displaying kindness. And these are the roles of a nurse according to Jane Watson. First, a nurse must develop a caring relationship with patients and approach patients as whole beings, bodily, mental, and spiritual. Kailangan nating approach ang ating patients not just partially but holistically. Second, spend quality time with caring moments for patients. Third, demonstrate unconditional acceptance and maintain a positive attitude toward patients' regard. Dapat walang bias when it comes to your patient. You must accept your patient as he or she is. Fourth, encourage good health by intervention and knowledge. So, according to Jane Watson, kapag isa kang nurse, hindi ka lang magfo-focus sa pag-heal sa isang may sakit, but also to educate them in order to prevent them from being sick. Here is a meta-paradigm of the caring model. First in the meta-paradigm is the transpersonal caring relationship, which lies on the category of health. In transpersonal caring relationship, it must have moral commitment. What does it mean when we say moral commitment? This often reflects religious or societal beliefs, but it may also derive from an individual's values about the importance of acting in a manner that affirms one's vows, promises, and obligations. Caring consciousness of the self as a person or nurse. Caring based on practicing and honoring wholeness of mind, body, and spirit in self. Inner harmony and authentic presence to truly be connected. And next is the caring moments, which lies on the category of human beings or person. It should be authentic and has intentional connection. What does it mean when we say intentional connection? It means it has a clear focus and yung purpose ng connection mo with your patient is also clear. Sharing meaningful human-patient experiences must be observed as well as honoring. It should be heart-centered in the way of being aware of your values, and you know how to take responsibility for yourself and your emotions. And next is the caring healing consciousness, which lies on the category of nursing. So how can we understand the concept of nursing? Simply by asking ourselves these questions. First, what does it mean to care for a person, family, self? How do I demonstrate my caring awareness and commitment? How do I define myself, a nurse, a person, the environment, health, and others nursing? How can I make difference in people's lives and alleviate their suffering? This question helps us better understand the concept of caring through medication and self-realization. And next is the last part of the meta paradigm, which is the clinical caritas that lies on the category of environment. First, the formation of a humanistic altruistic system of values. Second, the installation of faith hope, the cultivation of sensitivity to oneself and to others, the development of helping trust relationship, the promotion and acceptance of the expression of positive and negative feelings. 6. The systematic use of the scientific problem-solving method for decision-making. 7. The promotion of interpersonal teaching learning. 8. The provision for a supportive, protective, and corrective mental, physical, sociocultural, and spiritual environment. 9. The assistance with the gratification of human needs. And lastly, which is the 10th, the allowance for existential phenomenological forces. These are the 10 clinical caritas, and this will be further explained as we go on with the presentation.
Now, these are the 7 assumptions. The first assumption is that caring can be effectively demonstrated and practiced only interpersonally. Ang sinasabi lang po dito na ang pag-aalaga daw po ay nade-demonstrate or nagagawa lamang pag nakikipag-usap tayo sa ating mga pasyente. The second assumption is caring consists of curative factors that result in satisfaction of certain human needs. Ang pag-aalaga daw po ay nagko-consist ng pagmamahal na nagre-result sa satisfaction ng ating mga pasyente. The third assumption is effective caring promotes health and individual or family growth. The fourth assumption is caring responses accept person not only as he or she is now, but as what he or she may become. So tayo po na mga healthcare workers ay madalas nirespeto po natin at tinatanggap po natin ang mga pasyente natin kung ano man po ang kapalaran nila. So the fifth assumption is that a caring environment is one that offers the development of potential while allowing the person to choose the best action for himself or herself at a given point in time. Hayaan natin, respetuhin natin ang desisyon ng ating mga pasyente kung ano man po ang gusto nilang gawin sa kanilang mga sarili. Hayaan natin silang piliin ang pinaka-best na magagawa nila upang gumaling sila. So, the sixth assumption is caring is more healthogenic than is curing. The science of caring is complementary to the science of curing. So, healthogenic, it is hand in hand. Complementary daw po ang pag-aalaga at paggagamot sa ating mga pasyente. The seventh assumption is the practice of caring is central to nursing.
10 primary curative factors. The first is formation of a humanistic altruistic value system. As a nurse, treat all the patient as he or she is and respect their values. Even if they are different from your own, treat each patient and their family as if they were a member of your own family. In doing so, This gives satisfaction through giving and creates the extension of the sense of self. So, dito sa first curative factors, bilang isang nurse, tratuhin ang lahat ng mga pasyente bilang siya at bigyan ng halaga at igalang ang patient na parang kapamilya. Number 2. Installation of faith hope. Incorporation of individual cultural faith traditions in assisting patient with acceptance of current health status is a part of providing holistic care, and individualizing patient care will facilitate the promotion of positive health between the nurse and patient. So dito, ang pagsasama ng mga individual cultural faith traditions sa pagtulong sa mga pasyente na tanggapin ang kasalukuyang kalagayan ng kalusugan ay isang bahagi ng pagbibigay ng holistic na pangangalaga, at ang pang-individual na pangangalaga sa pasyente ay magpapadali sa pagsulong ng positibong kalusugan sa pagitan ng nurse at patient. Number 3. Cultivation of sensitivity to oneself and to others. Nurses have the ability to identify personal needs or values and differentiate them from patient to patient. Recognizing the difference promotes self-actualization through acceptance of others. So, dito sa number 3, ang mga nurse ay may kakayahan na tukuyin ang mga personal na pangangailangan o halaga, and yun nga, differentiate them from patient to patient. Number 4, development of helping, trusting human care relationship. This entails the use of effective communication skills to express one's feelings, to be accepting and perceptive of others' feelings, and consciously becoming involved with the patient and their families' lives and issues. So, dito sa number 4, nangangailangan ito ng paggamit ng mabisang mga nakasanayan sa pakikipag-communicate upang ipahayag ang damdamin ng isang tao at pagtanggap at pagdama sa damdamin ng iba. So, this is essential for transpersonal caring, the expression of both positive and negative feelings in the nurse-patient relationship.
The promotion and acceptance of the expression of positive and negative feelings. So this would be very important for nurses to put themselves in the shoes of their patient. This is very important because kailangan po nating malaman kung ano man yung nararamdaman ng ating pasyente para po ibigay natin sa kanila kung ano man yung proper care na kinakailangan nila, kung ano man po yung mga necessities at kung paano natin iyon ipoprovide sa kanila. So next is the systematic use of scientific problem-solving method for decision making. So this is also very important because example of this is to always think analytically. Problem solving is a cognitive mental process, so we should always consider the possible outcomes of every decision, to compare alternatives and to assess the possible negative effects of the decisions that they will make in the future.
Number 7, pagsusulong ng interpersonal teaching and learning. Ang pag-aalaga ay nasasangkot ng pagtuturo at pag-aaral na kapaligiran kung saan ang patuloy na edukasyon ng mga kawani at mga pasyente ay palaging nangyayari. Dapat ding tandaan ng mga nurse na lahat tayo ay maaaring matuto mula sa isa't isa araw-araw. Number 8, provision for supportive or corrective mental, physical, sociocultural, and spiritual environment. Nurses recognize that both internal and external environment influence an individual health and illness. The nurse provides a safe, emotional, spiritual, and physical environment for healing while incorporating all disciplines in care. Multidisciplinary team members play a part in providing a healing environment.
Number 9. Assistance with gratifications of human needs. The nurse recognizes the order of needs such as food, elimination, and ventilation before they can advance to higher psychophysical and psychosocial needs. Allowing gratification of human needs, both emotional and physical. Allowance for existential phenomenologic spiritual forces. Nurses have an acceptance of spiritual beliefs, which may be different from their own. Allowing for beliefs in things we can explain helps nurse have a better understanding of one's spiritual self.
Next, we have what's an ordering of needs. First in order of needs is the biophysical needs, which is under the lower order of needs. These are the needs in order for us to survive, and this is the basic needs like food, drinks, water, elimination, and ventilation. If you are wondering what is the difference or the meaning between elimination and ventilation, elimination is the act of discharging waste product out from the body, or what we call pagtae or pag-ihi. And ventilation is the movement of air into and out of the lungs, or paghinga. Next is the psychophysical needs. These are the needs for us to satisfy our psychophysical. For example, these are the screen time like Facebook, YouTube, and Netflix. Next is the psychosocial needs. These are the main goal of our mental and emotional like achievement and self-actualization.
Let's move on in the meta paradigm and nursing of Jean Watson. If sa prelims may apat, which is the person, health, environment, and nursing, same din sa midterms kay Jean Watson. Meron ding person, health, environment, and nursing. First is the person. According kay Jean Watson, human being is viewed as a valued person that needed to be cared for, respected, nurtured, understood, and assisted. And a human being also viewed as a different or a greater than others. Next is the health. Kay Jean Watson, binigyan niya tayo ng tatlong definition for us to define health. These are the high level overall physical, mental, and social functioning. Next is the general adaptive maintenance, level of daily functioning, and the absence of illness. Next is the environment or society. If dong sa prelims natin, the environment is the surroundings of the recipient, it is different according to Jean Watson. It is the caring, it focuses with the caring and the caring attitude. Okay? Environment, or the caring is existed in our society that is not transmitted generation to generation, but transmitted through our society. So we adopt caring attitude through our environment, through our society. Next is the nursing. The nursing is a profession that is concerned with promoting, preventing illness, and caring for the sick and health restoring. So it focuses sa pag-treat ng mga disease. Let's move on with Madeleine Leininger since we are done with Jean Watson. Born in Sutton, Nebraska on July 13, 1925. She is also certified as transcultural nurse and a fellow of Royal College of Nursing in Australia. Naging fellow din siya ng American Academy of Nursing like Jean Watson. Naka-earn siya ng diploma sa St. Anthony's Hospital School of Nursing in 1945. In 1951 to 1954, naka-earn siya ng equivalent of Bachelor of Science in Nursing and a Master of Science. Noong 1965, she became the first professional nurse na naka-earn ng Doctor of Philosophy in Anthropology. In 1960s, she was the one who first coined the concept of culturally congruent care, which is the theory of cultural care. 1974 to 1988, nag-serve siya as dean, professor nursing, adjunct professor, director, and became a full-time president. And siya yung kauna-unahan or the first member of American Academy of Nursing noong 1975.
Madeleine Leininger. She developed the transcultural nursing model and the ethno-nursing. She said that nursing is a humanistic and scientific mode of helping a client through a specific cultural caring process to improve or maintain a health condition. She is also the founder of transcultural nursing movement in education research and practice. These are the grand theories of Madeleine Leininger.
Transcultural nursing means being sensitive to cultural differences as you focus on individual patients, their needs, and their preferences. Transcultural nursing focuses on cultural dynamics that influence the nurse-client relationship. The areas of study and practice focus on comparative cultural care, values, and practice of individuals or groups of similar and different cultures are compared. The goal of transcultural nursing is culturally congruent holistic care, provide culture-specific and universal nursing care practices to promote well-being or to help people face unfavorable human conditions in culturally meaningful ways.
Transcultural nursing. Transcultural nursing is defined as a learned subfield or branch of nursing that focuses upon comparative study and analysis of cultures concerning nursing and health, illness, caring practices, beliefs, and values to provide meaningful and efficacious nursing care services to their cultural values and health illness contexts. For example, Jewish and Islamic women in a hospital setting. Jewish and Islamic women believe that modesty requires covering their head, arms, and legs with clothing. Respect their tradition and help them remain covered while in your care. Next is ethno-nursing. Ethno-nursing was developed to underpin the study and practice of transcultural nursing. It claims to produce accurate knowledge about cultural groups to guide nursing care, and it promotes culturally congruent care. For example, the study of Anglo and African American elders in a long-term care setting. It was discovered that both groups valued and received religious and spiritual care from their respective churches. Thank you all for listening.